And when this area is dysfunctional, it can cause a lot of problems in there. But you don't want to go too far. You go to maybe about C3 is the furthest you want to go. Get some of that extension to open it up, and then you're going to pull that tension straight up. That's going to help that open up. And what can happen, at the base of the occiput from C1 down to C2 is there's some nerves called the greater occipital nerves. They can get stuck to the deep suboccipital muscles. They can get caught through the upper trap. They can get caught in a lot of different areas. And if you can get in there and get some of that tension, it's going to allow this to help to glide a little bit better. And that's going to open that up. You're going to go down and find about C2, C3. And where you're going to go in there is you're going to sink, just like that. And then that's going to get your depth as you open up. And then you're going to pull tension straight up. And with this one, you're not going to stand up. You're just going to pull that. And you're going to lean back and pull that through as you go right up to the base of the occiput.